Hello, everyone. Welcome to everyone to today's webinar, How Technology Will Accelerate Your Behavioral Health Revenue Cycle in 2021. I'm Richa Singh, Executive Vice President for CollectRX, and today we'll be hearing from Ellison, one of CollectRX's senior account executives, about how behavioral health facilities can leverage workflow technology, data, and reporting to get their revenue cycle returning maximum reimbursements. We'll begin today's webinar with a presentation, and we'll have time after the presentation for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box that you see on your screen. We're looking forward to hearing your questions, and if we don't have time to cover them in today's session, we'll reach out to you afterwards to answer them directly. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. So for today's presentation, we're going to start with a brief introduction to CollectRX. After that, we'll discuss the challenges that we're seeing in the behavioral health revenue cycle. Next, we will give you an overview of our payor collections technology for optimizing the revenue cycle and talk about how we're able to generate results for our clients. We'll discuss how workflow, bots, data, and reporting will help you maximize your reimbursements in 2021 and what you need to do to take advantage of these opportunities. Finally, we will provide a brief overview of CollectRX's payor collection solutions and why Fortune 500 companies use our service. So let's start with a brief introduction of CollectRX. Who is CollectRX and why we're in a position to talk about payor collections for out-of-network behavioral health providers. Let me give you a quick overview of our experience in payor collections and specifically in out-of-network so you can see how we're well suited to see these trends. Despite our name, CollectRX has nothing to do with the pharmaceutical industry. Simply put, what we do here at CollectRX is help providers get higher reimbursements on in and out-of-network bills, and we maximize payor collections. Now, we don't do this as consultants, but as experts in negotiating and appealing in order to achieve higher reimbursements on your bills and collections. And we were founded by the founders of the out-of-network negotiations and appeals industry. And we have been singularly focused on helping providers get higher reimbursements since 2006. We've helped more than 4,000 providers nationwide optimize their reimbursements for both in and out-of-network collections. And we work with a variety of provider types, of course, including behavioral health centers, surgery centers, physicians, hospitals, and labs. And within the behavioral health realm, we've worked with over 500 behavioral health providers and worked over $200 million in behavioral health claims every year. So to get the results that we get, we rely on Qriksys. This is our proprietary system, which stands for CollectRX Information Systems. It's an analytics tool that we've developed to support us as we go toe-to-toe with payors, and it helps us analyze insurance policies, it provides comparable data, and it allows us to track the tendencies and trends of people on the insurance side. In addition to Qriksys, we rely on our expertise because what we've done is built a unique team of experts who used to work for the insurance companies and their vendors. So this puts us in a really unique situation to understand the soft spots in the payors positions and get higher payments on bills for out-of-network customers. Now, in building our team at CollectRX, we focused on hiring people who had previously worked for insurance companies and their vendors to reduce payments on out-of-network bills. So companies like the ones that you see on this slide, Aetna, United, Multiplan, Viant, and we also have doctors and in-house and outside legal experts. A lot of them have spent their time and efforts dealing specifically with out-of-network bills. So as a result, CollectRX has an experienced team that understands how to combat the tactics payors use to limit out-of-network reimbursements. So at this time, it is my pleasure to start today's webinar by introducing our presenter, Ellison. Ryan?
Hey, thanks for the introduction, Richa. So overall, behavioral health providers are facing many of the same issues that other providers are facing. So the top 5 billing and collections issues plaguing providers across the healthcare spectrum have been and show all signs of continuing to be, number 1, estimates are 5 to 10% of revenue is lost because of poor AR follow-up due to lack of time and technology. 2, whether it's in-network or out-of-network or Medicare claims, they're just not properly appealed and therefore money is being left on the table. 3, specifically for an out-of-network claim, 30 to 40% of revenue is lost on each claim because of the lack of data, time, and expertise to properly negotiate them. 4, billing systems are just not robust enough to handle the collections process, so most providers resort to using spreadsheets, which leads to claim slippage through the cracks. And 5, finally, providers are unable to properly manage their revenue without accurate KPI reporting. Now, all these holes in payer collections can add up to gigantic losses in revenue for providers. Now, for behavioral health providers in particular, there are added challenges with the disproportionate amount of their revenue being with out-of-network patients, whether through general network inadequacy or the need for highly specialized care, or what we believe we're seeing with payers much more aggressively removing high-cost providers from their networks, potentially preparing for future rate-setting calculations. Out-of-network isn't showing signs of letting up. Now, behavioral health continues to run into issues with payer contracting, despite toothless parity laws that have been in place for more than 10 years. A third of all inpatient mental health services are billed by out-of-network providers, dwarfing other subspecialties. Now, a 2018 study from the Ohio State University showed that enrollees with mental health conditions had cost-sharing payments for out-of-network care that were $341 higher per year on average than enrollees with diabetes. Individuals with drug disorders were also almost 13 percentage points more likely to have an out-of-network hospitalizations and more than 15% points more likely to experience out-of-network outpatient care than those with congestive heart failure, according to the same study. Now, in addition, those with drug use disorders paid $1,242 more per year on average for out-of-network care than those with diabetes. And individuals with alcohol use disorders paid $1,138 more. The study attributed the cause to limited availability of in-network mental health facilities and services. So, what COVID-specific trends are we seeing in out-of-network? Now, there are really 5 big areas that we're seeing the impact for all providers, but including behavioral health as well. Number 1, really just let's start there with the most obvious one, and that would be challenges with coverage. One issue with the pandemic here is that there's been a decrease in healthcare coverage due to an increase in unemployment. Also, as a way to cut costs, employer groups have been changing their plans, which causes confusion on who is paying for what and what is included in each individual's plan. Now, 2, across all specialties, we're seeing an increased denial rate. For some, the denial rate is over 25% for out-of-network claims. We'll talk a little bit more about those specific trends in behavioral health here in a second or 2. But 3, the payers are also using more increasingly aggressive tactics to deny claims. We'll also touch on that further in the presentation as well. Major 4 would be the payer backlogs that are really happening during the height of COVID, where we were seeing the time to pay jump by over 100%. And we continue to monitor this trend, and we've seen improvements. But as we return to normal in 2021 and anticipate a torrent of pent-up demand is going to be unleashed, not just in behavioral health, but also in all specialties. Now, we anticipate this trend moving upwards again in the foreseeable future. Now, 5, and finally, the lack of managed care contracts for behavioral health facilities. As we mentioned earlier, despite parity laws, most networks remain skinny, and most payers appear comfortable with denying or delaying care for mental health services. So back to the increasingly aggressive tactics that we're seeing with behavioral health providers specifically. Now, the first thing to know is that the payers are always looking for ways to control costs, i.e. the amount of time and money that they would pay out to providers. Now, one strategy the insurance companies use is to outsource a bill minimization tactic to a third-party vendor that specializes in helping payers reduce payment to providers through 2 main ways. 1, through an upfront negotiation, or two, through repricing a claim that's already been adjudicated. Now, you may have heard of companies like MultiPlan, Viant, NCN, et cetera, but it's really vital to understand that these are cost containment companies that are employed by insurance companies. And their job is to reduce payments to the providers. And I would recommend that you really do yourself a favor and venture over to their website so you can see it there for yourself, because it really is all laid out in black and white. Now, the goal here at the end of the day is to maximize a discount for a payer. And why do they do this? Because that's how these vendors like MultiPlan make their money. The vendors are going to be compensated on a commission basis, meaning the greater the discount, the higher commission that company can obtain from the payers. So again, what are we seeing with these third-party repricers that worry us? And to simplify it, what we're seeing specifically from one payer in particular is that we have a negotiation request from a company like MultiPlan. We will see the allowables in these requests topping out at very low amounts. And to give you an example of that, where we would typically negotiate an allowable of 90 to 100% of billed charges, that's starting to top out closer to 30 to 40%, which would obviously be acceptable for our firm, unacceptable for our firm. What's different now is that the claim is then going back and being reprocessed on the payer side, has an initial payment, but then gets filtered again through a secondary silent PPO. The good thing about this is that we can identify these claims and then initiate a negotiation a second time to push those allowables back into that 90th percentile. But let's be clear, these networks have always existed, but they're just taking more aggressive tactics now. On average, CollectRX can achieve an increase of about 80% of the initial payment for qualified claims. Now, the plans are increasingly being ignored as well. So frankly, they're really becoming irrelevant at this point. Payers have always had the option to honor a third-party contract at will. But these days, we find that they're more apt to disregard any third-party rental agreement. They either just process the claim to Medicare rates, or they use the tactic that we discussed earlier to revert that underpayment to the appeal process. So payers are also getting significantly more aggressive on patient authorizations. What we're seeing more and more of is an anomaly that are anomalies in the authorization process. For example, oftentimes the providers need an authorization for treatment prior to service, and that's after the fact. The payer is then deciding that, one, they won't pay the claim until they receive medical records, or two, that they pay the claim and then request the medical records afterwards. Then they say that they will recoup the money if they don't receive the record. Now, this is a delay tactic, to be clear. Now, if they request medical records, you only have a certain amount of time to submit those records. If you don't receive those records on time, if they don't receive those records on time, even if it's a day late, they'll automatically reject the claim, saying that they didn't receive those records. Either the provider will then have to submit it as an appeal, which adds more time to payment. Now, because you're submitting appeal now, the payer will also require that you submit other documentation along with the medical records, making it even more difficult for you. The payers are hoping that the information that they requested will not be sent. And for instance, United Healthcare submitted a request for medical records to one of our clients for claims going back to up to 3 years, saying that they were going to do a recoup of over $1 million if they didn't. Now, after working on the claims for 9 months, we were able to get them to accept and agree to close out the audit. And we received a letter stating from them that there was no refund by the provider. This type of situation requires an inordinate effort to resolve and distract staff from the more important work they're doing throughout the billing cycle. Now, the front end is key to managing your revenue. Now, if you're an out-of-network provider, this is extremely important. Whether there's a pandemic or not, it's critical to protect revenue up front. Verification of benefits, getting the eligibility of the patient, ensuring that they have all the network benefits that are acceptable there is all important to ensure that your service is going to be rendered and that you render will be paid for. Now, verify benefits when the patient is scheduled and then re-verify the day they arrive because benefits are changing on a rapid basis. Even if they have insurance, sometimes they may not have the correct out-of-network benefits. Consider what type of financial counseling that you may want to provide for those patients who have lost deductible plans and have a higher out-of-pocket. Ensure that you have a policy and that you're executing that policy for every patient that you see. Consistency is critical to avoid scrutiny. When you're getting your authorization, also do not rely on anybody but your own staff, meaning not the providers and definitely not the payer when they tell you that the authorization isn't required. And then, of course, document everything every time. You talk to the payer, document the name of the person you spoke with and what they communicated to you and why. Maintain these notes so down the road, if there's an appeal that needs to take place because the authorization was actually required, the information is all there in one place and you have it available to use. Now, your staff are the upfront experts on getting authorizations. You can deal with an appeal if a claim is denied for medical necessity or other reasons, but there's very little that you can do if there's no authorization. You really have no chance to overturn an authorization denial. Now, during benefits verification, verify the type of plan that they have, whether or not it's self-funded or whether it's a usual and customary plan, or, and this is also very important, whether it's a Medicare fee-limited plan, similar to an MRC1 or MRC2 plan that Cigna sells, for example. Then if you have the payers that have a specific form that they require from their patients in terms of the assignment of benefits or an authorization, make sure that's a part of your welcome packet so you can get all the signatures that you need in order to push that claim through. Now, out-of-network surprise billing. So new federal legislation was passed in conjunction with earlier COVID relief. And while it's still being operationalized, there's some good clues to what it means for behavioral health providers. So what's the good and what's the bad of it? So generally speaking, the surprise out-of-network bill is not expected to negatively impact behavioral health facilities. In fact, the legislation actually includes a provision to monitor and enhance parity legislation. Continuing to build on the ACA and prior federal laws, the legislation further enhances federal mental health parity protections with an emphasis on compliance regarding non-quantitative treatment limits, or NQLT, or NQTLs, on mental health or substance use disorder benefits. Insurance and group health plans will have to perform and document comparative analysis of the design and application of NQTLs on mental health or substance use disorder benefits. This information must be made available to the state and federal regulators on request within 45 days of enactment, along with the description of relevant benefits in each category, factors used to determine that the NQTLs applied to mental health or substance use disorder benefits versus medical or surgical benefits, evidentiary standards for those factors, and specific findings and conclusions regarding the results of the comparative analysis. However, we see challenges with the entire concept of regulating out-of-network, given that there are very few checks and lack of efficiency of those in existence. On-network adequacy for behavioral health, access to mental health services must be provided through out-of-network providers. While this particular bill does not infringe on this, we have concerns that it's the first step in a long-term plan to rate set out-of-network services. Now, using workflow technology, data, and reporting to really maximize your returns on out-of-network. And really the key reason for CollectRX's success is what we call our Qriksys business intelligence engine. Now, Qriksys serves as one of the largest out-of-network databases in the industry. No other revenue cycle company has as much information on out-of-network as we do. Now, Qriksys stands for CollectRX Information System, and it's a data and analytics tool that we've created to counteract the payer's effort to reduce payments on out-of-network bills. This is our proprietary software that we've developed to enhance payer reimbursements by automating AR follow-up, maximizing out-of-network reimbursements, and providing analytics and reporting. Now, many providers encounter issues with their revenue cycle because it's a manual, time-consuming process. They spend too much time identifying issues with AR rather than fixing them because they have to individually check every account's 835 data. They resort to spreadsheets or restrictive software to keep organized, and they have to make multiple calls on each account just to get the status. Now, Qriksys allows us to analyze actual insurance policies throughout the country to determine what is a reasonable and customary payment. Now, by analyzing these insurance policies, we're able to get detailed understandings of the plan types and language defining usual and customary. For example, they may want to pay 110% of Medicare. But when we go to the plan language, the policy could say something like reasonable and customary is what other similar facilities in the community charge. So we don't just rely on what the insurance company is telling us, we're going to go straight to the source in many cases. Now, the second component of Qriksys that gives us the ability to maximize revenue is a workflow engine. Now, Qriksys is a powerful tool that uses rules-based processing and AI to send claims to the right person at the right time for follow-up. It identifies those claims with the highest likelihood to provide additional payments and sends them to our staff for follow-up, ensuring that regardless of the volume of claims, we're working the ones that are most likely to impact the provider's revenue. Lastly, it provides us with an incredible amount of comparable data because we're constantly aggregating the data and results from our 4,000 plus customers that we service regularly. We use data and analytics to compare our determination of what's reasonable and customary with the payers, and in many cases, we're able to identify holes in their data and convince the payer to increase their payment right then and there on the spot. Our database captures business intelligence about the tendencies and trends of the people on the payer side as well. Now, our experienced team would know who to speak with at each of these companies, and we have the ability to get in touch with senior personnel at the insurance companies who oftentimes are the only ones with the authority to approve higher payments. Now, the way it works is we pull data into Qriksys from 3 different sources. First, we pull every account from the billing system so that we have the entire universe of the accounts receivable to follow up on. Then we track your clearinghouse's 835 and remit data from the payer. And best of all, we have robotic automation processes or bots that scrub payer websites to see how a claim is being adjudicated even before you receive that 835. Now, this is essential to reducing denials and days to receive initial payments. Account statuses will automatically feed into our system, eliminating the need to follow up every 7, 10, or 14 days because the bots are continuously pinging the payer websites. And since we get statuses even before you receive an 835, we can be more proactive in working your accounts as opposed to waiting for them to hit the clearinghouse or waiting for a paper EOB to show up at the office. So using all of this information, Qriksys will assign our staff at-risk accounts through a dynamic work queue to quickly correct and prevent further AR deficiencies. Challenges to AR like denials, delays, and underpayments are automatically bucketed and then sent for our staff to fix. Now think about how many collectors it would take to do all of this type of work manually. Now, on the screen here is a screenshot from Qriksys that shows you how we would pull in this 835 data from a clearinghouse or a payer's website to manage a client's overall AR. Now, while most billing systems work on an account-by-account basis, Qriksys allows us to drill down into different categories. So for instance, the top left window summarizes the account statuses as defined in the billing system. Clicking on the blue links allows us to view every account in the denied, paid, and rejected statuses so that we can take appropriate next steps and track each of our staff members' progress as well. Now, another example is the bottom dashboards, which pull in the reason codes so that we can easily recognize and report on root causes for appealing denials and underpayments instead of hastily writing off those balances. Now, one of our strongest procedures to optimize revenue is our in-depth reconciliation process throughout collections. Now, we found that when we follow behind other billing companies or in-house billing teams, there are many missed encounters, which can lead to a 5 to 10% missed revenue in AR follow-up alone. So we've put multiple checks in place to ensure that every single claim has been followed up on, processed by the insurance company, and then obviously tracking when the money's in the bank. Now on the screen, you'll see an example of a common mistake that's made by many providers when they're not taking the time to capture each encounter accurately and failing to reconcile billed claims to payment. So in this example, the provider billed 20 encounters and 17 of them were successfully processed by the insurance company. But because the provider did not diligently follow up, the 3 other encounters were never processed by the insurance company. Now, if each one of these encounters was worth $3,000 at the end of the day, that would result in $9,000 worth of missed revenue, again, just for that day. Now, start to think that if this occurred every day, it would result in over $180,000 loss in revenue for the entire month. And the point here is that even missing only 1 charge per day can add up to a significant amount of money lost in the long term. Now, another way technology is driving revenue maximization is workflow optimization. And understanding workflow is critical because the most common issues on the back end of collections are caused by breakdowns in the early parts of the revenue cycle, like clinical denials or incorrect 837 data. Now, we've automated AR workflow by identifying at-risk accounts so that a full-time employee doesn't actually have to spend the time doing this. Now, another point that sets us apart is our data and analytics. Really the fifth key to success. With Qriksys, we're able to export your data and import it into our systems to provide excellent reports like root cause identification, trends, projections, and revenue impact. We can do this on a weekly, monthly, or ad hoc basis to help you make more informed financial decisions quickly and manage cost to collection. Now, the issue with any billing system is that they're limited to canned reports that they can provide. So if you're ever interested in a report that the system doesn't have, just let us know and we'll be able to create it externally. So what is the benefit of technology, data, and automation? Why do some of the biggest behavioral health companies use CollectRX? Really, at the end of the day, it's all about what revenue cycle management teams can deliver. So for behavioral health providers, it's critical to maximize your reimbursement so that you can minimize patient collections. So the recurring theme from our payer reimbursement solution is making every claim count. Oftentimes, AR companies want to write off AR balances quickly for obvious reasons. The idea is to not have to touch every account, it's to have to touch the accounts when they can drive results. And the goal in AR follow-up is to not find claims that have payments, but to find claims that need a touch to generate that payment. Now, we cover the revenue cycle from billing to coding through patient collections and reconciliation. And really, it's all about results at the end of the day. And one of the nation's largest behavioral health substance abuse providers asked CollectRX to improve reimbursements on its struggling appeals department. And within 4 months, CollectRX dramatically improved performance. We were able to generate over $4.2 million for this provider on an ongoing annualized basis.
Awesome. Thanks. Yeah, thanks so much, Ryan. I appreciate it. That's a lot of good information, a lot of good stuff about technology and the data. So thank you for that. We've got a minute left. I do want to get in a couple questions for you. The first one here is, why isn't my multi-plan contract getting accessed?
Well, there's a couple different reasons, but the biggest one is that the payers are actually not bound to the terms and conditions of those agreements, believe it or not. I think that a lot of times companies like, Multiplan and other silent PPOs, they really kind of sell a provider a bill of goods telling them that by signing this agreement, they'll be in network with all of these different insurance companies, and that's just not the case. And at the end of the day, those agreements are not guarantees of payment. They are simply caps of payment. So again, just kind of recap, it's at the payer's discretion to access your agreements, and when it doesn't benefit them to do so, they do not do it.
Okay, great. And one more quickly, United Healthcare keeps referring to MNRP. Is this a Medicare policy?
Another really good question. Yeah, we touched earlier in the presentation Cigna's version of that, the MRC1 and MRC2. United Healthcare has one as well. They call it the MNRP plan. So again, just to kind of recap, that reimbursement there is based off of a percentage of Medicare. It is not based off of reasonable and customary language. So at the end of the day, kind of rule of thumb, if you're admitting patients that have these policies, you're basically accepting Medicare rates. That's what that means.
Great. Thanks so much, Ryan. And thank you all again for attending this. We hope that you guys got something out of it. If we didn't get to your question, we'll reach out afterwards, or if you guys have any further questions or want to discuss, we have some contact information on the slide. But again, thank you all for attending and have a great rest of your day.